Welcome to As a Woman, Fertility Hormones and Beyond. I'm your host, Dr. Natalie Crawford, and I am a board-certified OBGYN and fertility physician, and also co-founder of FFS-For Fertility in Austin, Texas. Each week on this podcast, I discuss health and fertility and how they relate to your true self. Become a part of the community of collaboration that amplifies others as a woman. I hope you enjoy the episode. You are listening to the As a Woman podcast. I'm your host, Dr. Natalie Crawford. Today we're talking all about basal body temperature, what BBT is, how it is utilized, why your temperature changes, and how you can utilize this method of fertility awareness in order to understand your cycles better, to help you get pregnant, or to help prevent a pregnancy. So BBT tracking has been around a very, very long time. This is not new information, but it has regained popularity. And if you've been around the podcast for a while, you know I love anything that promotes you understanding your body better. Your fertility is a sign of your overall health. I know sometimes we don't think about it that way. We don't think about our fertility until we want to get pregnant. And there's this idea that we spend so much reproductive life avoiding a pregnancy, and then suddenly we're turning around and trying to get pregnant with very limited information. So my passion has always been that you deserve to know about your body well before then. You deserve to understand if things are normal or not, get help sooner, identify problems sooner, advocate for yourself, and understand what variables in your life might be able to be modified to help you, 1, be healthier, 2, be happier, and 3, have an easier time getting pregnant or planning for your family if that's something you desire. Before we dive into this episode, a few housekeeping items. I am so thankful to all of you for all of your support on this podcast. Recently found out that we have over 5 million downloads, blowing my mind. So thank you. And we're going to be putting up a question box every Monday on Instagram at nataliecrawfordmd. That question box is going to allow you to ask questions. Many of them inspire these episodes, or they are questions which are answered at the end of the episode in our favorite segment, For Fertility's Sake, a little FFS for you. I also love answering your questions on the voicemail. So we have voicemail episodes where you're going to call in and leave a question and I can answer them. And those are my absolute favorite episodes. Sometimes I just think you don't even know the questions you have until somebody else asks them. So call and leave a voicemail at 657-229-3672. 657-229-3672. And this episode is coming out on May 12th on Mother's Day. And Mother's Day used to be a very hard day for me. So if it's a hard day for you, I just want to take a moment and acknowledge that I am sending you so much love. And I know how hard it is. I know that it can be hard for a lot of different reasons, because of your own relationships or loss, or because of the stage of this fertility journey you may be in, or the uncertainty in the phase of your life. And all of those can make it hard. So no matter what, try to make this day, and even if it's not Mother's Day, if it's a different day, a little bit about you. You deserve the best in the world. You deserve to understand yourself and to be healthy. You deserve moments of peace and relaxation. So I'm hoping that sometime today you get outside and you hear the birds and you soak up the sunshine and you take a moment for you, because you deserve it. I have some personal, very, very big news, and if you have been a part of my community for a long time, this news will be announced in just a few days, and I am over the moon. It is something that I have worked years, plural, for and been told no many times, and I am in disbelief, so happy that we're finally at this place. And so stay tuned for some very exciting updates. If you don't follow along, follow on Instagram at nataliecrawfordmd and sign up for the newsletter. You can find the newsletter at nataliecrawfordmd.com/newsletter. There are going to be so many exciting updates and a lot of me giving back to you, because I'm just thankful. I wouldn't have any of this if you hadn't supported me in educating people about their fertility back when everybody said that nobody wanted to learn about their bodies, or that women couldn't handle all the bad news that's centered around infertility and fertility. And I said, that's false. Women can absolutely handle it. And in fact, they want to know their body. So again, follow along, sign up. Thank you. I can't wait to share it all with you. All right, if I'm going to dive into basal body temperature, you know we got to start with ovulation. Basal body temperature is detecting the rise in your temperature, which is going to occur after ovulation. If we think about this, what we know is that when your body makes progesterone, the progestational hormone, your core body temperature rises. There's a lot of nuance to basal body temperature, and I'm old enough to remember well before we had calendars on our phone or cycle tracking apps. I know, hard to believe. People would bring in graph paper with their basal body temperature charts. And I loved it because, I love data. I love things like that. But that's what we're talking about, friends. We're talking about graph paper stuff. And you have apps and you have cool wearables and devices that can try to do this for you. But it's very important to understand that data out's only as good as the data in. So you have to understand this entire concept so that you can know if the tech is helping you or not. Your basal body temperature, BBT, at its core, it is your body's lowest set point of temperature after a period of rest. There are many things that impact your body temperature. I bet everybody can think of one right now, such as having a fever. So there's different things in your world that can impact your temperature, and how you check your temperature is actually very important. So if you're going to track your temperature and you're going to use a thermometer, not a wearable, you are going to take your temperature as soon as you wake up, before you even get out of bed, before you talk, drink, have sex, check your phone, eat, anything, go to the bathroom, you're going to take your temperature. The thermometer, so old school thermometers, they were a mercury-based thermometer, and they have to be in your mouth for 5 minutes. So you can see why this is quite tedious. And the reason why is that the change in your temperature would be very, very small. So a fraction of a degree. You have to get a thermometer that will measure at 1/10 of a degree. Some basal body temperature thermometers are digital now, which can make it a lot easier, and they give you a little beep. And then you'll record your temperature on the graph paper, and you can either write it down, but you can Google this. You can go to Planned Parenthood's website and see the different graphs. And you can even get your own and print it out to actually mark. And you're going to notice that you're going to have some variability in your temperature every single day. Now, if we think about what's happening inside the body, and just remember, and we constantly have multiple different things happening at the same time inside our ovary. I like to imagine that at the start of the month, you have, everybody remembers my vault, inside your ovary, you have a vault of all the eggs you're ever going to have. At the start of a month, a group of eggs are all sent out of the vault, each egg in a follicle. So you have a group of follicles available to you at the start of a month. The brain is going to send out follicle stimulating hormone, FSH, and FSH is going to stimulate a follicle to grow. It's a well-named hormone. I love it. What FSH is going to do, stimulate that follicle. That follicle is going to grow, mature the egg, and make estrogen. As it makes estrogen, the estrogen is going to talk back to the brain, and the brain is going to then decrease the amount of FSH it sends out. It says, I already have an egg growing and I don't need a litter, so I'm going to send out less FSH to not have multiple follicles. But as your estrogen keeps rising, as the egg keeps maturing, eventually the brain will hear a certain signal, and this will be an estradiol level of 200 picograms for 50 hours. That's a very specific amount. But when the brain sees that, it says, showtime. We now have a follicle that has a mature egg inside. Let's ovulate. And the brain will then send out a surge of LH. And the surge of LH is what you can detect on an ovulation predictor test. So I have a different episode and I have YouTube videos about OPKs. OPKs are utilized to check when your body is having the LH surge. And an important note about those is that you have to detect the first surge, because after that first moment, LH is going to rise and fall and rise and fall. It is released in pulses, and if you are not constantly checking daily with an OPK, you might miss the initial change, the uptick from low LH to high LH or pulsatile LH. That LH surge, the first one, ruptures the follicle, allows the egg to be released. This is ovulation. And that's probably where many people's brains end. They think, I've ovulated the egg has 24 hours to be fertilized by its friendly sperm, and the end, if I don't get pregnant, I'll have a period. But my favorite part of the cycle is coming up. So what we just discussed was the follicular phase, aptly named because a follicle grows and the primary hormone released from the brain, follicle stimulating hormone, FSH, and this is an estrogen dominant phase. If you come to my office and I check hormones and you're in the follicular phase, you should have low, medium to high estrogen, depending what day you are, and a low progesterone. So if somebody's going to come in here and talk about the estrogen to progesterone ratio and diagnose you with something, you best not be in the follicular phase, or they are fooling you and tricking you into buying whatever they're selling. I said it and I mean it with a lot of love, because you're smart enough to not fall for that. Low progesterone is the definition of the follicular phase. After you ovulate, that follicle, though, now turns into what we call a corpus luteum. Fascinating. The corpus luteum now changes architecture completely, and it becomes very fatty and very ready to make hormones. What luteum means. But the corpus luteum is now stimulated by luteinizing hormone, or LH. So those pulses of LH that are being sent from the brain are stimulating our corpus luteum to release progesterone in pulses. So progesterone starts to be produced from that corpus luteum when you're ovulating, right after you've ovulated, when the corpus luteum is healing up, and now you're going to start making progesterone. Because progesterone in the luteal phase is a response to the pulsatile secretion of LH, progesterone rises and falls throughout the entire luteal phase, but it should be above 3 nanograms per milliliter. That is what's confirming to us you have ovulated. If your progesterone is less than 3, you have not ovulated. If your progesterone is more than 3, you have. 3 is as good as 7, is as good as 15, is as good as 32, is as good as 40. It doesn't matter. It all depends on which proximity to the LH pulse from the brain I checked it in, and there's no way for us to know that. So, progesterone is going to rise and fall throughout the entire luteal phase. And this progesterone is such an amazing hormone. Progesterone does so many things in our body. This is what allows us to carry a pregnancy. It, by definition, is the progestational hormone. Progesterone is going to slow you down. It wants to protect you. It wants you to be a little more nauseous and not eat the crazy foods, not be as experimental. It wants you to get more sleep, save up some calories to support the baby. It wants you to not go crazy and go socialize, maybe be a little more homebody. Don't get sick right now. You're going to feel bloated, sore boobs. You might have sensitivities to smell. You also are going to have an increase in your body temperature. The increase in your body temperature is going to raise. In general, we will say your normal basal body temperature in the follicular phase is going to be 96 to 98 degrees. Now, after ovulation, it is going to go 97 to 99 degrees. So anywhere typically from 1/2 to 1 degree higher than whatever your normal temp is. So number one, I can't just bust a basal body temp in my mouth around day 14 and say, did I ovulate? Because I don't know what my basal temp was all the days before. And very similar to the OPK situation, the shift in the temp is what is most important. And you don't know when that's going to happen, so you have to plot it out every day. So for the basal body temperature, once your temperature has risen that 1/2 degree to 1 degree, and it stayed high for up to 3 days. So you can say, I have had an actual biphasic shift, meaning my temperature was hovering around this set point and now it's hovering higher. You have to see a few days because every day you're going to have a little bit of variation. But once you know it has been high for 3 days, now you know in retrospect, I ovulated 3 days ago. Well, how does that help you if I know now I ovulated 3 days ago? It's a little bit of a retrospective approach, and it can be very helpful in the future if you have very regular cycles. So maybe another way to say this is that you are the most fertile the 2 days before you had your first increase in temperature. That's because the egg can live for only 24 hours and your temperature is not going to rise until the follicle has rehealed and become a corpus luteum. So ovulation day and the 24-hour egg day happen before you ever saw the increase. Then you see an increase and it stays high, you have confirmed, in fact, I did ovulate, but that was before I ever saw the shift in the temp. So from the day the temp rose, you've already bypassed the survivability of the egg, if that makes sense. So BBT can be a little bit frustrating for people, especially if you have some irregularity in your cycles. Because if you have not had sex and suddenly you see a temp rise, you're out. The egg is no longer around. Even though sperm can live for a while, if you didn't put any there, sperm can live for 5 days in the female reproductive tract. But if you didn't put any sperm there and there was nothing to fertilize the egg, then this month is a wash. So do I like BBT? I do. But It takes a certain type of person. I'm never a fan of anything that causes you more stress or more overanalyzing than need to be. So maybe this is very affordable and easy for you, and this is something that feels very routine in the morning. And if you have regular cycles, this is where it holds a lot of predictive value. If you have cycles that come every 29 to 30 days and you are constantly seeing your temperature rise for the first time on day 16, then you know day 14 and 15 are your most fertile days. So in the next month, you can target those days. And if your BBT has not risen yet, those are still really good days. And then when your temp does rise, you can confirm if they were in fact good or not. An argument to if you have regular cycles is, why do this over and over? Why confirm you're ovulating? Why track it all? If you know when it's happening, you can target it. And a lot of people, I find this to be true, if they have done BBT for a few months in a row and they have consistent cycles, they see a similar pattern and then they know when to target. Remember, the 5 days before and then the day of ovulation are going to be those most fertile days. So I would say if you have a temperature chart on your calendar and this is the day your temp tends to rise, the 2 days before are the very most fertile days, but that entire 6-day span are times I would try to have sex. Try to put sperm in the reproductive tract if you're trying to get pregnant. It's important to note again that your world, your environment, your body can influence your temperature. So if you're sick, if you're not sleeping well, if you're depressed or anxious, if you're smoking cigarettes, drinking alcohol, jet lagged, in a new time zone, if you've been using an electric blanket, all of those things can change your temperature. So you have to remember that our body temperature is a reflection of our metabolism, and our metabolism is also a reflection of our brain interpreting the world around us. Have you ever noticed that if you haven't eaten very much or you're calorie low, you might start to feel really cold? So a reminder that the temp may not be accurate if those things are going on. 2 questions to wrap this up. Well, how effective is it at helping you get pregnant? 2, what if I want to prevent a pregnancy? And 3, who is it good for and not good for? Well, I'm so glad you asked. As you know, or you might not know, I have a huge passion in natural fertility, which we call fecundability. Fecundability is the probability of getting pregnant every month, and all of my fellowship research when I was an REI fellow all centered around fecundability, trying to understand our body, what helped people get pregnant without fertility intervention, and the world around us. So that is my very strong passion and why we have all been brought here together for the podcast. So one of the projects that I did was a comparison of the different methods of fertility awareness. So this includes cervical mucus monitoring, ovulation predictor kits, OPKs like we discussed, and basal body temp. And we looked at both trying to use one of these methods versus using nothing, or comparing the different methods. One thing that's important is this was a very large cohort study and it was prospective, so people enrolled and then followed and they just did their natural behavior, and so there was no actual intervention. The intervention was just purely collecting data. I love this stuff. There were 571 women who contributed over 1,500 cycles of information, and what we saw was that compared to using no method of fertility awareness, so nothing to track your cycle, using basal body temperature had the highest rate of getting pregnant. And this was the only significant finding, and you had a 3 times higher rate of getting pregnant than using nothing. That said, if we compared them, BBT versus OPK, OPK versus CMM, CMM versus BBT, there was no difference between the comparison of them and getting pregnant. And so the take home was that any method of fertility awareness was positive, helped you get pregnant. BBT was the most independently versus nothing, but anything was better than nothing. And compared to each other, there were no statistical differences. Personally, I think you're much less likely to use the BBT method unless you have very regular cycles, because otherwise it's endlessly frustrating. And so I do think this might have self-selected people who had more regularity or more knowledge of their cycles versus people who were checking cervical mucus or OPKs, or definitely those with nothing. But that's just a hypothesis. It's a prospective study, so it's giving us data. So my overall take home is that understanding your cycles and tracking them can help you get pregnant. If you do have regular cycles and you use any of these methods, then I think it's just important to know what works for you. Personally, when I was trying to get pregnant, I was an OPK girly. It just was less mental space. I could pee on the stick, look at it. I like the digital, yes, no, throw it in the trash, carry on. But I know people who like all the different options, and definitely cervical mucus is the freest. So you can do whichever works for you, but understanding your cycles is very helpful. If all of it's too stressful and you have regular periods, have sex every other day. Have sex every 2 to 3 days. You got it. You're going to hit your fertile window at least twice, and you're going to have sperm there around the time of ovulation. So you'll be fine. If you do know when you ovulate, if you have middle schmerz and you feel your ovulation, bang it out on that day. Have sex that day. That's the absolute best indicator. You have your own ovulation predictor test. It's your body. Your body always trumps the other options. Other things that you can do include knowing when that fertile window is starting. So if you think you ovulate based on tracking on a certain day, count the 6 days back, and then target intercourse in that window, trying to hit the day you think you're ovulating, and you're going to be good. Basal body temperature is very frustrating if you have very irregular cycles. Semi-irregular, they may be helpful. It might allow you to understand if you did in fact ovulate when you think you did. But ultimately, if you're not getting a consistent pattern and you're really following all the rules and doing a good job, there could be some underlying issue. And sometimes there are issues that we have in our ovulation. And I'm a big believer that the first stage of ovulation dysfunction is a luteal phase defect, aka not making good progesterone from your corpus luteum. Our friend, the corpus luteum, which is what the luteal phase is named after, should be set. It should be 12 to 14 days in everybody. That is the length of time your corpus luteum should last until it dies. And what do I mean by that? That sounds terrible. It dies. If you get pregnant, a pregnancy is going to implant and it's going to make HCG, which is the pregnancy test hormone that you will detect on a UPT. HCG is now going to constantly and increasing, because HCG rises, your pregnancy test gets darker. Now that progesterone is going to be made at even greater concentration. So we do have progesterone levels we like to see when you're pregnant based on having enough progesterone to support a pregnancy, because at this point, we're no longer dealing with pulsatile progesterone release. You now have a constant and increasing stimulus for that corpus luteum to make progesterone. Interestingly, the placenta will make progesterone, but it's not fully grown in until around 9 weeks. So the body is 100% dependent on your corpus luteum, which is made from the follicle that you ovulated, in order to make progesterone for that first part of the pregnancy. And if something happens, if you have surgery, if you lose that corpus luteum, then suddenly you're going to miscarry unless you have progesterone replacement. So progesterone is so important and so fascinating. And again, a lot of people get a lot of information wrong on it to try to sell you progesterone supplements. I have seen people who are trying to get pregnant on progesterone every single day because of their estrogen dominance. Essentially, they've been on birth control and they've been trying to get pregnant for a year. It's maddening. And this is somebody who loves natural things, trying to understand her body, seeking help, yet didn't understand enough to know that what this healthcare provider was telling and prescribing and telling her to buy was hurting her, was preventing her from getting pregnant. Makes me furious. But if we're going to talk about preventing pregnancy, you can absolutely use BBT to prevent pregnancy. So what that means is that you're going to avoid having sex, avoid it, until you've seen the elevated temp for 3 days in a row. So 3 days, it's high. Now we know the egg has been ovulated, it's out of our system, and you can go to town for the rest of your cycle. But that means if you're using BBT for your method of fertility awareness and family planning, you're not having sex for half your cycle. And that influences the success rate because you'll see this very big range. So our methods of fertility awareness, good methods for natural family planning. So BBT, OPK, cervical mucus, calendar tracking, is that effective at preventing a pregnancy? And you will see rates between 2 to 25% of people who utilize fertility awareness method will have an unintended pregnancy. So on the up end, 25% is 1 out of 4. That doesn't feel very happy to me. However, 2% feels a lot better. And so it probably depends which method you use and what you do in the off time. Meaning, there was a study looking at BBT alone, and because it's so tedious, in people who abstained, had no sex, or had they had protected sex in the non appropriate time or the days before the 3-day rise, so the follicular phase and the periovulatory phase, that group had a 2% chance of unintended pregnancy. In those who sometimes tried the pull-out method or were not 100% perfect with using condoms or protective sex, then their rate was much higher. What we usually say is that using multiple methods is going to be better. If you have regular periods, then these are going to be more accurate. They require daily tracking, so being consistent with it can be helpful. And if you're willing to use other methods of birth control, such as condoms or abstinence, during the potential fertile days, then this is going to be a more accurate way to try to prevent a pregnancy. It certainly is going to give you a lot of information about your cycle and something that I think can be very, very helpful if you're transitioning off of birth control, but not yet really ready to start trying to have a baby, but want to learn more about your body. All right, well, now we've learned more about BBT, basal body temperature. I'm going to answer a few of your fertility questions. So again, these are questions that you have submitted through Instagram at nataliecrawfordmd every single Monday. And some of these questions will be answered here, some on Instagram, and some on the newsletter. So sign up for the newsletter at nataliecrawfordmd.com/newsletter. All right, question number 1. How much are my chances of conceiving reduced by having only one fallopian tube now? So there was a study done looking at ectopic pregnancies, and in one group they had a tube totally removed from the pregnancy, and in the other group they cut it open, took out the ectopic, and sewed it back together. And the subsequent pregnancy rates were the same in both of those groups. So that's really reassuring. However, my answer is going to be, it's going to really depend on what got you into the circumstance of having one tube. An ovarian torsion, a cyst, that's so different than pelvic inflammatory disease from chlamydia, or a massive abdominal infection, or severe endometriosis. So the etiology behind what caused the tubal damage, is it isolated or could it be potentially bilateral / was it in your entire peritoneal cavity? That impacts how I counsel patients. Also important to know that removing a fallopian tube has been shown to decrease the follicle count of that ovary, even if you leave the ovary in place. Maybe due to blood supply, maybe it comes back later, but that is something. So for example, if you have a hydrosalpinx, a dilated fallopian tube with water on the tube, and we know we need to take it out because that's associated with a 50% decrease in pregnancy rates, even with IVF, we're going to wait till we already have gone through IVF and we have the embryos before we go take it out. Why does the body release more than one egg every month if only one egg is ovulated? This is an amazing and a fascinating question. Why are ovaries and testes so different? Why do men have germ cells on their testes that allow them to make 1,500 sperm per second, 200 to 300 million per day? Whole new batch of sperm 3 months from now. Fascinating. Yet I'm born with all the eggs I'm ever going to have, and I have 6 to 7 million at 5 months as a baby inside my mom, 1 to 2 million when I'm born, 500,000 by the time I even start having my period, and 25,000 by the time I'm 37. I run out of eggs at this crazy exponential rate, and I'm losing more eggs when I have more. So there's a redundancy to this. Something about the rate of aneuploidy, putting more eggs out there so that there's a better odds of choosing a good one. I don't have the answer. We know that it happens though. We know, obviously, because that's the group of eggs we can get to grow when it comes to IVF. That's the cohort we have to work with. But why is it that way? I don't have a good answer for that. It is one of those things that really highlights the difference between gametes of the ovaries and the testes. Interesting, you only ovulate typically around 400 eggs over your entire lifetime if you have ovulatory cycles and you're not preventing ovulation. What happens if I get pregnant but my hypothyroidism isn't under control yet? Hopefully nothing. But it really does depend how bad not under control is. In worst case scenarios, having severe hypothyroidism that's not treated is not providing your baby with any thyroid hormone because the fetal thyroid gland doesn't start making thyroid hormone till after the first trimester. So your baby's dependent on your thyroid hormone. And if you have hypothyroidism, you don't have any, or you don't have enough. You don't have enough for you. You definitely don't have enough for the baby. And you can have severe developmental delay and brain issues. Thyroid is so important. You can also have a higher rate of miscarriage, preterm birth, preeclampsia, stillbirth, a lot of things we don't want to see. So this is why we, your fertility doctors, I speak for us all, are literally obsessed with your thyroid. It is something that is a lot easier for us to fix and hopefully prevent any bad outcomes. But most of the time, if your thyroid is just a little bit not in control, we'll just increase your thyroid hormone and everything will be fine. All right, well, those are our questions today. So I hope you enjoyed this episode, learning a little bit more about tracking your cycles, basal body temperature to help you get pregnant, not get pregnant, understand your body, and ultimately be your own advocate for your health. Would love it if you guys would follow along on Instagram, YouTube, sign up for the newsletter, ask your questions on Mondays, and ultimately sharing this episode, supporting me. I can't wait to share my big news. Thanks, friends. Thank you all for listening to As a Woman. It would mean so much if you could rate, review, and follow the podcast to be notified of new episodes every Sunday. I hope you learned something new, and I hope you share it with someone in your life. Be sure to follow along on Instagram at nataliecrawfordmd and check out the YouTube channel Natalie Crawford MD. If you're interested in becoming a patient, you can also follow Fora Fertility. I'm so thrilled to have you here, part of the community that amplifies others as a woman.